Hi everybody, Dr. Ben here, and I'm here with my awesome associate, Dr. Lisa.
Hello.
All right, so we're here, part 4 of our new patient orientation, to teach you a couple of great tips. Sorry for the bad sound quality. We forgot our lapel mics today. But we're going to be showing you a couple of things: how to use your phone, how to sit, how to sleep. What else do people want to know, Doc? What should I do? Work areas, all of these little quick tips so you can take. Oh, we're going to show you the T, Y, and I stretch, okay? And it's going to be really great. I know most of you guys live somewhere that might have a doorway, so that's all you need for this cool little stretch. So the first thing we're going to talk about, which everybody has, what do they have, Doc?
Cell phone.
Cell phone. Cell phone. And we want to teach you how to save your neck. So, Doc, let me have you actually stand up right here. You're gonna face that way and show us what most people do on their cell phone. So when you're walking into an elevator, everybody's on their phones, just like this. Your kids, your friends. How are we looking at it, Dylan? We good? Right. And you know, you start straightening up that neck. Now, this position, Doc, can you show me a forward head posture? Just forward head posture. Now you see more and more people getting this forward. Show me normal. And now show me forward head posture. Now, forward head posture is going to give you a couple of things. The headaches comes from this, TMJ, neck pain all along the sides, the back, trap and shoulder pain just from forward head posture. And most of it is coming from the cell phone. Show it to me, Doc. Boom. You know, hours. How many hours are people spending like this? On average, 2 hours a day looking down at their phone. And if it's not a phone, it's their laptop. Thanks, Doc. And so it's an iPad. It's something of that sort, giving a lot of people pain. And another thing that it does is it also rolls in the shoulders. You've noticed that. You see a lot of people now in that constant forward head posture, really ruining their posture. Even these kids now at young ages. So if you have kids on these electronics, really try to make sure that they do better. One of the things that I like to do is if I have kids or people want to be on electronics, a lot of us are in bed on our phones, Doc. Let's show what people do. And they'll pile up some pillows and they'll tilt their heads and they'll be sitting just like that on the couch or in their bed on their cell phone. And again, this is the same position in standing, so we don't want that. I don't want you to be watching TV like this, on your phone like this, or anything of that sort. Now, we'd say, hey, we're going to put a pillow under. These are the goodrollpillows.com. Good Roll Pillows. Wonderful pillows that we use and we recommend under your neck. Well, Doc, I can't see my phone. And now you got to be like this, right? This is more appropriate. I know the hands get tired and then people roll onto their side and then they're doing this. Again, I'm here to save your neck. I'm teaching you all the things you need to do at home to make sure that all the adjustments and the time that you put into improving your spine really help. So now, if you have kids, kids are not going to do this on their iPad. So can you roll onto your belly and show everybody how to work on your phone on your belly. Now, what she's doing here is she's keeping her neck up. She's holding that back posture. And again, this might not last for a while, but if the kids are on the electronics, I make sure that they're on their belly, working on the iPad or whatever it is in this type of position. Again, I'm just trying to come up with solutions to a problem that's making everything worse. Let me have you sit on up for me, Dr. Thanks again. So the other rule that we have in the office, what's the other rule with the phone?
Hold your phone up.
Hold your phone up. Keep your phone up. Keep your head up. And really try to work on there. I know it looks weird when you're in the elevator and people are standing around. They think you're taking pictures of them or video. Just tell them, no, my doctor's saving my neck, right? So having that posture kind of be forward and our phone here really saves your neck. I know our arms get tired and they start to go, and it's really up to you to limit your time on your phone. We're not the phone police here. We're the neck police and the spine police. She's got a badge. Where's your badge?
It's on my other jacket.
It's on the other baggage, all right? Spine police. All right, so that's what we're doing to help. So those are the phone. Couple of tips with laptops. Well, maybe I'm gonna post some pictures in the video so you can see where if you're working on a laptop, what do most people look like when they're working on their laptop? Can you show us the side? Show us the side profile. On their bed, right? Working on, or even worse, Doc, you know what else I've seen?
What?
I love when I see like pictures of, everybody's on their bed or they're doing this postural thing, right? They're like, oh, I'm just gonna work on my laptop, or they're just doing all these crazy positions.
Or coffee shops.
All right, coffee shops, and they're really kind of rude. And then they walk in when they say, my back's not getting any better, or my neck's not getting any better. How do you like my Valley girl?
It's accurate.
Accent right there, right? It's not getting any better, Doc, right? So, and then we can see them on the couch on the side and how they sit. We know what's going on. So, a couple of tips that we like to give is, can I have you get me that side posture one more time? Actually, have a seat for me here.
This one.
Sweet. Nope. Swing your feet around that way. Swing. Both feet forward. So, if you're working on at a desk and you're on your laptop, most of the time you're like into the laptop. You're working like this. One of the things that I like to do if you're at home or at your office is to get a secondary monitor, okay, where you can plug in your laptop and work off your laptop and keep your monitor here, keeping your spine straight and your neck up. Now, I'm a big fan at the office, whether you have a desktop or a laptop, to keep the monitors high. The higher you keep, so watch my Doc, if the monitor's here, if it's here, and if it's here, again, we always want that good posture, good cervical curve, and good chin being held up. So if you're working off a laptop, get a $100 monitor, plug it in, and it'll save your neck. So you're not looking at this little tiny monitor for hours on end. If you're traveling a lot, nowadays they got these foldable keyboards and keypads where you can kind of just plug it in. And now I tell people to like put their laptops on a higher area, maybe a shelf, stack of books, reams of paper, and then plug in the keyboard and kind of work off of that if they have to do a lot of keyboards, and an auxiliary mouse. That will help your posture. Or else those laptops, we see them, people come in, they're working while they're on the couch, and they'll start like that. What do they turn into in about 5 minutes? They just, and my neck is hurting, my back is hurting, and they're doing it right in front of us. So if you're working off a laptop, get an auxiliary monitor for an extra $100, or you can spend like $20 to $50 and get yourself a foldable keypad that you can travel with, and then save your posture for the hours that you're spending on the computer. Okay, so we covered phone, we covered computer, we covered work computer and the monitor. We want to make sure that it's high and eye level, higher than eye level sometimes. Let's talk about posture during sleep, right? All right, great. So one of the key things that I like to show when on sleep is, stand up for me quickly, Doc. You want to sleep like you're standing, right? If we don't walk around like this, or we don't walk around like this, or belly sleepers, right? If you're a belly sleeper, do you imagine if you walked around for hours like that, your neck would hurt. So imagine sleeping on your stomach with your neck turned to one side or the other. That's just going to be unhealthy, and it really ruins all the work that we're doing here to make sure that your neck is healthy. So one of the things that we want to do is we want to show you today how to sleep and how to position pillows. Are we in the pillow business?
No.
We are not in the pillow business. What business are we in?
Spine.
We're in the spine business. We're keeping your spine healthy and keeping it functioning. So what we're going to do is we're going to show you the pillows we use. It might not be great for you based on your neck, but the x-rays we take in the office really tell us what's good for you and what's not. So in the office, and I know personally at home, I use the Good Roll, and it's great. One of the key things here is, you can take out the filling to match your comfort. You can also use these clips here to make it a little thicker. Come on there, Clippy. There we go. Make it a little thicker, or you pop those clips out and make it a little thinner. So I always recommend sleeping the way you stand. So we got an arch here and we have an arch here. Now it's hard to keep something under the back, so I got a little trick to that. So first thing first, a lot of people who toss and turn is because their neck is not comfortable while they're sleeping. Most people put the pillow right here and they're sleeping like this, so they'll wake up with more neck strain, okay? I'm gonna show you on the adjusting table. Lay down for me. So for the most part, most people put the pillow right there, and they got a big pillow and it's thick, and they'll wake up and they'll end up with neck pain and strain and shoulder issues, or they'll toss and turn all night. What we recommend here is having the pillow under your neck and kind of forming it, because your neck has a curve. That's how she's sleeping right now. It has a curve right there. We want that pillow right here. Now we got a secondary curve right there, right under the lumbar. Some people say, I can't lay on my back. My low back hurts a lot. Well, we'll take the second pillow. Here's a quick little trick. And we'll put it right under the knee. You can go ahead. And now that helps to reduce the pressure under the back. And this is a key way. So if I was to stand her up, she'd be pretty much lying down the same way as she'd be standing. So this is great. You could put multiple pillows under here and really kind of get it to about here, and that takes a lot of pressure off. Again, you got to see what works for you, but this one is the key. And again, we use the Good Roll pillow, goodrollpillow.com, designed by a chiropractor, so we know patients love it here. They order it all the time. So this is key. How's it feeling, Doc?
Great.
Now, some people say, well, Doc, I can't sleep on my back. I've tried. I get you, right? Not everybody can sleep on their back, but you can train to sleep on your back. So I can't bench press 200 pounds, but I bet I might work up to being able to bench press 200 pounds if I worked at it incrementally. So what I always say is, hey, can you start out doing 10 minutes a night sleeping like this? The first 10 minutes, I want you to sleep this way. I want you to add 5 minutes every week for me, right? So I could start with maybe 20 pounds and add 10 pounds every week or every couple of weeks and get my arms stronger. And we're gonna train your body to get into this. Now, some people, after just a week or two, find themselves sleeping more on their back than they've ever had in their whole life, just using that. Again, start out with 10 minutes. You don't have to make it the whole night, but start 10 minutes. Add 5 minutes every week to the time, and soon enough, your body will get used to sleeping onto the back. So that's a great thing to try out. You'll definitely enjoy it. Tweak the pillows to your liking. And we're not in a pillow business. We use these because we like cervicals. Now, a lot of people say, hey, Doc, I'm a side sleeper, right? I'm a side sleeper. All right, so let's take a look at sides. Now, it's hard to sleep. Well, Doc, I'm going to lift this up for you, if you can stay there. Now, notice I can kind of get I don't know if you can see it, but I can get my hand under her neck right about here. And there's about that much space, right? She's got a nice neck curve where her head hits the adjusting table into her low back. Good. Now, if I turn her to the side, facing you guys, notice how much space now is between her neck. You can just lay it there on my hand. Her neck and the mattress. So the same pillow might not work, okay? So even with the good roll, I'll lift up your head, Doc. I'm gonna clip these in so I can make it a little bit thicker. It might be a good roll, it might have to be another pillow, but for the most part, we wanna have a good support sideways. Now, I can tell you this, if your pillow is too thin, I'm gonna lift this up, what you're gonna tend to do is, Doc, I want to give you the thinner one. And most people are going to put their hand under their head, or they're going to put their arm under the pillow, and yeah, they're going to sleep like that. And that's going to give you the shoulder pain. That's going to give you the neck pain, the trap pain. A lot of people who sleep with this, it's because their pillow is too thin on their side. They'll sleep this way, they'll sleep that way. A lot of neck pain, okay? So we don't want that hand over there. We don't want the arms over there. So Doc, I'm gonna switch out the pillows again. And we want you to get a pillow that's gonna keep your neck, look, none of the muscles are activated here. Nice and relaxed and happy. The second pillow we're gonna use, I don't have the pillow that I like, but it would be a flatter pillow, more rectangular. But a second, see, the knees don't like to touch each other, so it aggravates it, and neither do the ankles. So you need something like this. And if you have a third pillow, I'll take your glasses off. If you have a third pillow, I usually put the pillow right in between, so you're hugging something. You have a teddy bear, pillow, I don't know, whatever stuffed animal that you like. Kind of keep it right there. Hold on to it. And if we were to stand her up, Dr. LaSalle would be pretty much kind of like this, which is still better than sleeping like that and any other way. So we want to have good nose to sternum to belly button to knees, pretty much a straight line. Now what most people do when they don't have this, straighten out your bottom leg for me, Doc. They'll sleep like this, and guess what? They're complaining of hip pain, hip joint pain, lumbar pain, low back pain, knee pain, all of this because most people tend to sleep like this, or they'll have their leg all the way out here while they're sleeping, and you sleep like this for a few hours. It's horrible. Yep. Okay? The last one that most people do is a no-no. Doc, can you show us how to, what's horrible? So when people are sleeping on their, and they're doing this, imagine sleeping like that. I know you think it's comfortable. They might sleep partial. Yeah, they'll do this, okay, this thing here. Neck pain, hip pain, knee pain, low back pain. And check this out. When you're on your stomach, you have absolutely no back support. The mattress was designed for you to sleep on your back, possibly on your side. And that's exactly what you want to do. So sleeping like this will give you all of these issues, and they're repetitive. So once we work on our patients and they come in and they're still having this, we know it's a habit that you have that's horrible. So these are the ways we want you to sit, sleep, work at your computer. You can sit on it for me, Doc. And again, we have some pictures that we'll add on to this. So I'm going to teach you a couple of stretches. Everybody, what should I do as far as stretching and how it should go? The best key stretches are going to be to stretch before you go to bed. So it's nighttime before you put your cervical pillow under your neck and get ready in the under your knees. These are a couple of stretches that you should do to help you unwind. Okay, Doc, can I have you on your back for me, please? Thank you so much. One of the key issues, most people end up with tight backs, right? So tight back, tight hips. So the key thing that we want here is a stretch. Now, most of the time, if you try to stretch directly into your chest or sternum, you can feel there's some resistance. So I say just come out about 10 to 15 degrees and you should have a little bit more further movement. This isn't the only thing you should do. I like a little push into the hands. So push into your hands for me with your knee. You're pushing into the hands. You're actually activating the muscles so they a little bit fatigue, a little bit come under stress, and then they let go 5 seconds and they'll go a little bit further, okay? And you're gonna do that 2 or 3 times, possibly 45 seconds to a minute, okay? Let's try the other side. Off to the side, and you're gonna push for 5 seconds, 4, 3, 2, 1, and you want to pull just a little bit more. And you'll notice every time you do that, you get an extra pull, and that really helps the glutes and the low back muscles to decompress. You're gonna sleep better. A couple of the other ones that you can do are usually this one where you rotate to the side and really get a good stretch. And you know, we don't have a mattress here, it makes it a little bit harder. And then you're just going as far as you can, getting that oblique stretch. These will help out a lot. Overall, you know, do your cat stretch, whatever feels good to you. Okay, so those stretches right there will just help you kind of relax your muscles, get in bed. Now, if you're having a hard time getting out of bed or getting out of bed in the morning is difficult, the best thing to do, a lot of people have low back pain and they're trying to get out of bed. It's hard to go from a cold start to jumping out of bed. So sometimes it's easy just to pump the hips right there. You can do the same side, opposite side, back and forth. And just before you get out of bed, get some blood flowing, get the muscles to wake up before you try to swing out of bed. Now, we're going to show you the proper way to get up, especially if you're having low back pain, how to get out of bed, right? So Doc, you're going to turn to the side. You're going to swing your feet up and then push up. Now, same thing goes for lying down. Can you lie back down? You're going to sit down and swing. Now, a lot of people do what? They try to leverage like that. They'll try to grab their legs and leverage up. All of that pain and pressure comes right into the low back. We do not want that, okay? The people at the gym, Doc, show me like a hook that table, and they'll hook their legs and right? Ruining their low back, blowing out their discs, okay? Now, she's doing it because she's under professional observation here. We're supervision. I'm a professional, so I'm letting her do this, okay? So that's what we want to make sure, so you don't hurt yourself, you don't do that, and you don't cause more sciatic, low back, and disc issues, all right? So great. We showed them how to get out. We showed them some stretches. We showed them how to sleep. We showed them how to use their cell phones and their laptops. Let's show them a couple of those TYI stretches, okay? All right, Doc, you can come on down here. Now, most of the time, if we all tend to kind of walk more shoulders rolled in, being on our cell phones, being on our laptops, it's just habit. Most people are like this. They're not walking around like this. So we're going to show you a couple of stretches to do throughout the day, whether you're at home or in your office. We're going to cut to the door, and we'll be right back. Hi. We're having fun today. All right. Well, we're here, and we're going to show you how to do the most famous TYI stretches you've ever seen. Okay? So, everybody's got a doorway. I hope you do. Well, some people don't, you know, you live in LA.
True.
And maybe you're at work and your shoulders get a lot of pain, your neck has a lot of pain, and most people, what they do is they'll crank their head down like this and they'll start stretching, which is actually the opposite of what people should be doing. One of the things is you're already too rolled in. We want to get you rolled out, okay? You gotta have fun today. That's what I'm saying. All right, so you go to the wall here. We're gonna put one arm here, one arm there, and we're not going crazy. I'd rather have your posture straight. Put one leg in for me, Doc. Great. And you're just gently leaning in. It can't be too hard. And we're gonna open up this area, open up the sternum. Take the pec muscles that are there and just kind of chin up for me too. Take a nice deep breath. Allow your anterior sternum to open up, the ribs on the big side, and you're just holding that. Not really squeezing, you're not bouncing, you're just holding and letting it stretch. Okay? You're going to do this for about 20, 30, 40 seconds, whatever you feel comfortable with. But it is opening up the shoulders, keeping the chin up high. So this is the T stretch. Now we're going to go to the Y stretch, very similar, but it's going to be more of a Y angle. Again, chin up for me, and you're just leaning into the stretch. I don't want it super like all the way out here, just leaning in, and you should feel it there. You should feel the obliques on the sides right there into the arms, and just really opening that up and bringing your chin up to also to really have that. And that helps a lot to make sure that your body opens up. A couple of deep breaths for me, Doc. Super duper. Love it, okay? And then the last one is the eye stretch, which is done one arm at a time. We're gonna show you two ways. We're gonna show you from the front, and it's just that. You're not pushing very far out. You're just getting that whole shoulder blade, the pec muscles here, shoulder blade back, the pec muscles here to open up, and really just getting this pec major and pec minor portion of this muscle to unwind. If you just poke around right there, you'll feel it that it's tender. Oh, ow. Everybody has it. We're all rolled in shoulders, so this helps open that area a lot. I'm going to show you what it looks from behind. If you can swing around for me, Doc, using that way. Just like that, and nice posture, chin up. And this is going to help you at your office. Do this a few times a day. If you find yourself being on the computer a lot, it's going to help you just to kind of open up, get your chest opened up, breathe better, takes the tension out of your shoulders. Thanks, Doc, you can come out of that. And then that helps the most. The last one throughout the day that I like is elbows straight, grab your wrist, chin up, and you kind of doing that stretch for a few seconds and helping everybody out. Anything else we need to cover, Doc?
I like it.
That looks about it. I hope you enjoyed this. Listen, you can forward this to any of your friends, families, co-workers, in-laws, outlaws, whoever they are. They're going to benefit for the series of our new patient videos. Again, we are here to help you. Dr. Ben, Dr. Lisel, we are at your service. I hope we can help more of your family and your friends here in the upcoming years. And that was good, right?
That was good.
Yeah, all right. Bye.